setting up for contact isolation. So first, you throw on your gown. Make sure everything is tied. Next, you're going to put on your gloves. Make sure they're the right size so they're not too tight, not too loose.
Oh, yeah. What are you wearing tomorrow? Yeah, I'm saying it right now.
And then before you enter the room, you want to make sure that your mask is on so you're not a risk to the patient or yourself. And you enter the room and you're ready to interact with the patient. Okay, so to take blood, we're going to have Vacutainer, alcohol wipe, some gauze, and we're going to collect it in these vials. So first, go over to the arm and wrap the tourniquet around it, not too tight. Just enough. Then take the alcohol swab and swab the area in small circles as they gradually get bigger. Give it a few moments to dry. And you're going to open up Vacutainer and dispose of the garbage. You want to be careful. Top. Then you're going to gently insert into the vein. You should be able to feel it as it enters. And then begin blood collection. When you're done, remove the vial and put it away. Hold down in the site with gauze and undo the tourniquet. Ask the patient to hold and remove Vacutainer. Put the protective seal and then dispose of safely. This is contact isolation, taking blood.
Yep.
Okay, so after you're done with the patient, you want to take off the most contaminated and work your way to the least contaminated. So first, you want to take off your gloves. One, ball it up in your fist. Take off the other one so it's just like a bag. Throw it out. Next, take off your gown. And then fold the contaminated area inward and roll it up. And then throw it for washing. And lastly, remove your mask and dispose of it. And that is removing your gown for a contact isolation.
Prepare for an airborne interaction with a patient. You just need to put on your gown first. So just tie it at the back. And over here. Also make sure that the hair is tied back. And then we put on our gloves. And for airborne, we wear N95 masks. Taking blood from an airborne isolation room. So what we need for as our personal equipment is an N95 mask, gloves, and a gown. And for taking blood, we have hand sanitizer to clean our hands, and then we have the vials. It depends on how many you need. We also need a Vacutainer, alcohol swabs, and gauze. So we'll just lay it all here. And we need a tourniquet to make sure the blood flows well. So we're just gonna tie it into a knot, into a type of knot that we could easily take off with one pull. So just use an alcohol swab to clean the area of where we'll be injecting the needle. We start in small circular motions and then spreading out.
Wait, how are you supposed to do that?
Then we can throw it in our regular trash over here. Then we get our Vacutainer ready. And we just pull this back. This can go into our regular trash. And we should make sure that the and we just pull it out. Then our vial side. Pull out our tourniquet. And then secure the place to the gauze. Then we just pin this up. And this goes into our sharps container. And that's it. And don't forget to clean up after. Okay, so I just came back from an airborne isolation room. So we take the most contaminated to the least. So first we start with our gloves. We pinch this part, curl it into a ball with our other hand, and then get it with your thumb from underneath, and then try to put it in so that you don't touch the dirty area. Then we untie our ribbons from the back. And then we get it from underneath, so we don't touch the dirty area. And the same for the other side. And we curl it into a ball, going in to a ball, dump it in the bin, then take off our masks.
I'm going to teach you how to prepare yourself to go into a droplet isolation room. So first, you're going to want to put on your gloves. Make sure you grab the right size so they're not too tight or too big. And then, you're going to want to put on your gown. Make sure you tie it up in the back. And that it's a comfortable fit.
I'm thinking mostly around 2:30.
And then you're going to want to put on your face mask to protect yourself.
Oh, I did, that's right.
And then your full face mask. And that's how you prepare yourself.
Droplet isolation. So first I'm gonna get everything ready. I have my Vacutainer, my gauze, an alcohol swab, and I have 2 blood tubes to collect the blood. I also have a tourniquet for the patient's arm. So I'm gonna begin by opening the gauze to get it ready. And then I'm just gonna leave it beside us. Okay, so I'm gonna put the tourniquet on the patient's arm. And making sure that it's able to come off easily, you just loop the one side. I then have my alcohol swab, and I'm gonna start in the middle and make circular motions towards the outside, cleaning the area. And I can throw it out to the garbage beside me. I then have my vacutainer, which I'm gonna open up. I can take the safety off, the cap off, and then the hole in the needle goes towards the sky. I can then find an appropriate place for the vein and stick your needle in. I'm going to grab my blood collection tube and place it in the vacuum and then take it out. I have another one. It's a suction, so it should come out right away. Okay, so I'm gonna put the blood collection tube inside, and it's a vacuum, so the blood will come out right away. And once it's done, you can just take it out and put it beside you. You can then take your tourniquet off and get your gauze and hold it over top of the collection area and take the needle out. You can then ask the patient to put their fingers over top to hold down for pressure as you put the safety on top of the vacutainer and put it in the sharps container.
So first you're going to take off your gloves. You're going to want to pinch the inside of the glove and pull that off. And then roll it up in a ball. So go from underneath here. Make sure there's no contact with the contaminated part of the gloves. And dispose of that. And after you're going to want to untie your gown and go from underneath and take it off. Same with the other side. Try not to get it onto yourself. Then you're going to roll it into a ball and put it for washing. Then you're going to remove the head mask, put that to the side, and then take off the breathing mask and dispose of it.
I'm taking blood out of her thigh. Because she doesn't want to listen to me. Stab her there. She doesn't want to listen to me, so I'm going to take blood out of her thighs.
Get myself familiar with my machine.
I actually hate her. Yes. I like actually think taking blood out of these things.
Okay, Miss So Power.
This is a heavy arm.
Hopefully those are.
The levels in mine. I put mine over here. They're right here. Natalie, you don't see these?
Can you
my
relax?
I'm gonna inject.
I'm gonna inject into my patient.
This is for bloopers.
What else am I gonna inject? Is it thinking on it?
Yes, there's a thing on it.